My name is Oz Schaefer. I'm with the National Center for Brain Health. I'm here to talk about our exciting new program to develop concussion screening specialists. Despite what you hear in the news, most concussions are not the result of organized sports. Would you believe that girls under the age 13 actually have more concussions than boys, and those concussions are more severe? A Boston medical study found in its general population that more than 50% suffered one or more concussions that was undiagnosed and untreated. The classic symptoms for concussions are a problem with focus, memory, mood swings, and antisocial behavior. Sadly, when these symptoms manifest in a young girl, they're written off as hormonal or maybe even the influence of the new boyfriend. In young boys, it's ADD, ADHD problems, and that invites the use of drugs and sometimes special classrooms. If concussions aren't treated properly, the focus problems manifest itself later in life as inability to hold down a job. The mood swings create an inability to have meaningful relationships. And according to a New York study of its school system, 75% of the non-drug related youth offenders showed signs of a concussion. Later in life, concussions manifest themselves as spousal behavior, spousal battery, and even suicide. Sadly, the medical community over the last 40 years has failed to step up and make a difference. Their efforts can best be described as a charade. Imagine being wrong more than you're right. It seems that if you can't drug it, the best thing to do is just to ignore it and it'll go away. To stop this epidemic, holistic practitioners, coaches, sports trainers have to step up and find these concussions so that they can be treated properly. National Center for Brain Health has created a course so that you can make a difference in your community by becoming a concussion specialist. To illustrate the importance of this, I'd like to tell you a story about a young girl named Terry who suffered a concussion but did not know it. She fell off a horse in between the 5th and 6th grade. She wasn't wearing a helmet, but was taken to the emergency room of the hospital and was cleared. The family was elated because the doctor gave her clearance and told her to have a great summer. A few weeks later, when she entered the Magnet Charter School as an A student, her life totally went downhill. She found that she was struggling to make even C's and D's. She was a constant disruption in the classroom. And on the advice of the girl's counselor, she was sent to a psychiatrist. The psychiatrist quickly assessed that Terry's problem was that moving from the small classroom of grade school to the 1,000-student campus of the junior high was more than she was able to handle. His solution was weekly counseling sessions and, of course, a prescription. After almost 3 years, Terry spent most of those 3 years in special ed because she wasn't able to make any in the normal classroom environment. By accident, Terry's father heard a National Center for Brain Health specialist speaking to a group of combat veterans about undiagnosed concussions and what the signs were. Terry's father came up to the concussion specialist and said, "My daughter isn't old enough to be a combat vet, but she has almost every symptom you described. I don't know where she could have gotten the concussion, but could you test her?" Terry was tested for a concussion, and the results indicated that there was a concussion, and those results were quickly confirmed by a neurologist, who called the psychiatrist that had watched his patient decline over the last 3 years, and whose solution had been stronger and stronger drugs, to inform him that Terry didn't have a psychological problem, she had a concussion, and she wouldn't be back for his care. Approximately 6 weeks after being removed from the psychiatrist's care, Terry's mother started to notice that her daughter's Normal personality was starting to re-emerge. She seemed to be doing a little bit better in school. But sadly, Terry's 3 years behind in school now because of spending time with special ed. But fortunately, Terry's grandmother, a former school teacher, stepped up and said that she would homeschool her. After 2 years of very hard work, Terry became an A student as she entered the public high school with 2,500 students as a senior. She's graduating and going to college, all because her father met a concussion specialist. How many Terrys are in your community crying for help that you could provide if you add concussion training to your specialty? I invite you to step up and make a difference in your community. Most people spend their entire life wondering what they can do to make a difference. You won't have that problem as a concussion specialist. Make a difference in your community, add to your bottom line of your practice.